I'm going to go over the end-of-life patient and talk about assessment. I'm not going to be demonstrating it, I'm just going to go through some of the points of it. So this patient could present as being a cardiac patient. They could have cancer or another life-limiting disease. But as far as I know, it's been cardiac failure and cancer, but this patient I'm concentrating on has a stage 4 cardiac failure. So they've come into hospital basically to be assessed for end-of-life treatment, and we need to control and manage their symptoms better. So basically you need to know what they've been admitted with, what's their diagnosis, what's their prognosis, which is poor, and the symptoms. So our patient was admitted with, as I say, end-of-life treatment, but they are a cardiac patient in stage 4 cardiac failure. They have increased cardiac pain. The nausea and secretions associated with the condition they're in have increased. They have poor mobility and increased fatigue and also dyspnea. So what are you concerned about? You're concerned about the patient having the best care and about them relieving these symptoms. We want to reassure the patient when we meet them that that's what we're here to do, and greet them with a warm tone and smile. One of the first things you can talk to the patient about after you've done the preliminary introductions, check their pain score, is are they comfortable in that position? This is very relevant to somebody in this condition because positioning can improve a lot of symptoms, pain, and also breathing and nausea. So for this patient in particular, it's quite important to offer them assistance to reposition. Symptom control. So do we know what the triggers are, the relievers, what medications they take or have tried already? Have they got non-pharmaceutical techniques, such as relaxation or distraction techniques? And does positioning and movement affect any of these symptoms? So if we look at the symptoms one by one, we've got pain. This is to be scored when we initially meet the patient, but if you did forget, just ask them later on when you think about the pain and ask them to score it between 0 to 10, with 10 being the worst pain. We're going to look at their drug chart. So we will mention the drug chart and say, if you're currently in pain, I'll be able to go and look at the drug chart and see if there's anything available. Quite often as well, they may have already just had painkillers, so we'll explore that with the patient, how long ago. Breathlessness, so this is a common thing in all end-of-life conditions, but particularly in a cardiac patient, they're going to experience breathlessness. It's almost guaranteed that the patient will have breathlessness. They may even have it on rest, not just activity. So again, positioning. There are certain medications which can help as well. So we can talk to the patient about that and maybe talk about some deep breathing exercises which can increase lung expansion and can be a bit beneficial for them. Nausea. Nausea may be one of the main problems they're coming in with because this is highly likely. The sort of medications they're on, the condition they're in, and the other factors contributing to it, such as constipation and poor mobility. So this patient may well also present with nausea. What would you do normally if somebody has nausea? We're going to look at medications. We're going to offer them a vomit bowl. We're going to talk about triggers, and I'll go into all this a little bit more in a minute. Elimination. So listed as one of the top symptoms by NICE of people in end-stage cardiac failure. Constipation is a problem. This is likely due to lack of mobility, lack of diet and fluids, but also due to morphine, which would constipate anybody. So we do need to make sure that they're not in too much discomfort and it's not affecting other areas such as nausea. So hydration. This patient is not being educated on how to increase the hydration and how to be fully hydrated, because they're actually just being kept comfortable at this time, and it's what they can tolerate. As we know, it may trigger vomiting. So talking to the patient, if they are struggling with just even managing sips, about what we can do. So that could be a doctor, we could talk to the doctor, or we could also talk to the palliative care team about that. Mobility, so we would expect this patient's mobility to be pretty much poor and restricted. So we'd like to know how much assistance they currently require. So when they're in hospital, if we need to take them to the bathroom, or even if they wanted to go for a walk, we know that they need assistance. And are they using a device such as a walking stick or a rollator or a Zimmer frame? Or do they actually need a wheelchair? So those things should be explored with the patient. Fatigue is a very common symptom that a lot of people who are receiving palliative care complain about. So fatigue, although fatigue may not be a main concern of yours, it may be something the patient's struggling with. Extreme tiredness, not being able to communicate properly because of it, or to enjoy any of their hobbies. So we would reassure the patient and maybe just encourage them to take more rest if that helps, rather than trying to stay up for a long time in the chair. Maybe they do need to go to bed more often and have more sleep. Washing and dressing, obviously, if they're not mobile and they're breathlessness and pain, they may need some assistance. So how much assistance are they generally getting at home, and do they want that same level of assistance now they're in hospital, or is it going to be a bit more difficult because maybe they've got a walk-in shower at home, something? So we'll explore that with the patient and offer them some help where needed. Sleeplessness. So this is another major complaint of people who are suffering. Ask the patient if they suffer. It doesn't mean he will suffer, but if he does, ask if he does and offer some help with that, and possibly that we could speak to the doctor, and also some holistic remedies, such as keeping the room at the right temperature and lighting, and just releasing some negative thoughts or active thoughts when you're going to bed. And just we could go through with the patient and mention it to the doctor also that they're struggling. So we can discuss with the patient also if they have any wishes they need us to try and help them with anything particularly. If he doesn't have any concerns, what about how his family are coping, him and his family at home? So when you're doing this assessment, it should be a holistic assessment, which does include the family, and also it includes other factors than just his physical. Mental, physical, spiritual, social, his activities, and all the things that, that contribute to a proper holistic assessment. You can ask the patient if they have any particular wishes, how they would like us to treat them, or anything that they couldn't do themselves or their family couldn't do, something more personal they want to speak to us about. How are his family and him coping at home? During the holistic assessment this includes the family, and we need to know, is he safe when he's going home? Is his wife safe? Is she able to manage washing, dressing and mobilising him? And how's she coping emotionally, mentally? Are there any friends involved or family that are helping? Do they need outside help? Have they got to the point where they need care assistance or some sort of help at home? For the patient, also, while they're in hospital, we need to think of something for them to do. So distraction can help with pain and nausea and other symptoms. So we can often talk to them about what they usually like doing. Obviously they could have some music, with some headphones, a tablet to write or search the internet, books, newspapers, TV, what sort of things do they enjoy, which they can do while they're here with us. Spiritual needs. Is the patient religious? Or were they in the past religious and would like to speak to somebody? Or do they just want a spiritual conversation with somebody and the chaplain would be the right person? So we could offer that as well for this particular patient. And for me, for assessment is just the overview of how to deal with this patient. And we are going to demonstrate it and show you that in a video as well.